Thromboembolic device stockings. So what are they? Thromboembolic device stockings, also known as elastic stockings or thigh-high anti-embolic stockings, are essentially a compression sock that extends to either below the knee or to the upper thigh. These are intended to promote regular venous return and reduce swelling in the lower extremities in patients that are post-operation, low mobility, or that stand or sit a lot in one place. So how do they work? For example, we have a patient that has just had a surgery in which recovery will result in lowered mobility. Our patient could experience pooling of excess fluids or venous blood in their lower extremities, which would cause swelling, discomfort, and could lead to clotting. This can be caused by a decrease in heart strength or simply by gravity. Thromboembolic device stockings work by applying gentle but constant pressure on the veins and tissues of the lower extremities, which keeps the veins from expanding and therefore reduces the pooling of blood and fluids, while promoting regular venous return to the heart. So if we were to explain this to our patient, Miss Mary Lee, who has a limited understanding of English, we would need to greatly simplify this information for her. We could say things along the lines of, Miss Lee, these socks will help reduce swelling and discomfort in your feet, ankles, and legs. They're going to feel a little bit tight, and that's good. We need that pressure to ensure that added fluid won't collect in your feet and legs. Giving a simplified version of what the stockings are and what they will do for Miss Lee will help her understand why she is being encouraged to use them, and she'll feel more comfortable using them.
So based on the scenario, Mrs. Lee, who is 50-year-old lady, was recently discharged from the hospital due to congestive heart failure, and her doctor recommended the use of TED stockings for her daily use. So as we all know, congestive heart failure develops because your heart is weak or damaged and cannot pump blood efficiently. So eventually, blood and other fluids can back up inside your lungs, abdomen, liver, and lower extremities, and can cause swelling or edema. So in this case, what is the purpose of this device, which is the TED stockings on Mrs. Lee? So it will help in maintaining external pressure on the muscles of the lower extremities, thus promoting proper blood flow from the legs to the heart. This will also reduce pain and leg swelling. It will boost circulation in the legs and act as vein support. It will also help in preventing the deep vein thrombosis. So what is deep vein thrombosis, or the DVT? It is a condition that occurs when blood clots form in veins deep inside your body. These clots can occur anywhere in the body. However, this condition often affects the lower legs or thighs. So DVT might be a serious condition because a blood clot can travel to the lungs and block an artery, and this is called pulmonary embolism. And the last purpose of this device will help to prevent venous.
Proper care and maintenance of TED stocking. Rinse them with lukewarm water immediately after pulling them off each day. Hand wash your TED stocking. On drying, don't squeeze them. Instead, change them or lie them flat. Don't use dryer. One of the best recommendations is to purchase more than one pair. It will create room for you to wear on one while you can dry the other. Correct use of TED stocking. Insert hand into stocking as far as the heel pocket. Grasp center of heel pocket and turn stocking inside out to heel area. Carefully position stocking over foot and heel. Be sure heel is centered in the heel pocket. Begin pulling body of stocking up around the ankle and calf. The stitch change should be fall between 1 and 2 inch below the bend of the knee. As thigh portion of stocking is applied, start rotating stocking inward so the gusset is centered over the femoral vein. The gusset is placed slightly toward inside of leg, and top band should rest in gluteal fold. Smooth out an excess material. Pull toe section forward to smooth ankle and instep.
Assessment before use. Check for edema, temperature of the leg, color, lesion or ulcers, and check for doctor's prescription. Assessment after use. Assess edema for amount of swelling after removing socks. Check for bruise or redness caused by bunching of the fabric. Special instructions: do not use when sleeping. Remove socks at night or at bedtime and moisturize leg. Patient health education for effectiveness on the proper use and care of the TED stockings. Patient should show positive response towards the teaching and clarify concerns for better understanding.
Already short of oxygen, ischemia, or is abnormally swollen, a compression stocking or sleeve will compress the smaller blood vessels near the surface of the skin, making it more likely that the tissues will be short of oxygen, potentially causing tissue damage, as well as in someone with peripheral neuropathy, as pain signals may not be noticed because of nerve damage. A TED stocking is not to be used if you have ischemia, peripheral neuropathy, congestive heart failure, diabetes, cellulitis, allergies. The potential risk if there is misuse of this device, it can potentially cut off circulation, cause bruising of the leg, itching, redness, and irritation, swollen heart veins, tenderness or loss of circulation that persists in one or both legs, leg cramps that persist in one or both legs, redness or warmth to one of your veins, a weak pulse or pulse that feels out of rhythm, bluish or purple skin, and difficult breathing or rapid breathing.
Prevention. Get fitted by a certified fitter. If there is a fluctuation in body weight, get fitted every year or 6 months. Use donning gloves when putting socks on to have a better grip and to avoid tear on the fabric. Wear socks in the morning when you're less swollen to maintain the leg size. Get a new pair every 6 months. Compression is guaranteed for 6 months of everyday use.